A 25-year-old man comes to the emergency department after a motor vehicle accident. Vital signs are stable and physical examination shows contusions on the chest and upper extremities, but is otherwise unremarkable. The contusions are tender and erythematous. Which of the following is likely causing the erythema in these tissues? Choice A, vascular endothelial growth factor. Choice B, interleukin-10. Choice C, nitric oxide. Choice D, interferon beta. Or choice E, interferon gamma. I'll wait 5 seconds and answer the question. USMLE will come up with all kinds of different ways to test this same basic concept, but really all you need to know is about your acute phase immunology / biochemistry stuff, right? Now in this particular question, it's right after a motor vehicle accident, so it only has been, at most a couple hours. Usually a minor wound like the one this patient has. Early phase, you'll have prostaglandins, bradykinins mediating pain, histamine, and nitric oxide being released to cause vasodilation. So here choice C, nitric oxide, is the correct answer. Usually within a couple hours, it also includes certain interleukins getting released. IL-1 and TNF-alpha are ones you want to know in particular for, vasodilation and a lot of septic shock too, right? IL-1, TNF-alpha is a lot of times that's the end result. Now when we start talking about stuff like VEGF, growth factors, and fibroblast growth factor, that sort of thing, that's usually not until a couple days later. So here, for example, choice A, VEGF, you can argue that VEGF, because it causes blood vessels to grow, that it can be a part of what causes erythema. But it's not the best answer choice here because this is more of a acute phase, hours later reaction rather than one that's taking place days later. Now, obviously, if nitric oxide wasn't an answer choice here and you had some other throwaway answer, then you would still pick choice A, right? But in this case, you have a better answer. Choice B, interleukin-10. You need to know that interleukin-10 is an anti-inflammatory cytokine, and I think as far as USMLE goes, that's really all you need to know. Now, as far as the interleukins go, I know for a lot of you, especially early on in your prep, you see the interleukins and you just freeze up because it's just like, oh my god, all I see is a bunch of weird numbers. Unfortunately, I can't really tell you much other than that sometimes there's a lot of things you just gotta sit down and memorize, and the interleukins is one of those things. There's a couple mnemonics you can use. For example, hot T-bone steak is a popular one for the first 5 interleukins. Hot, IL-1 for fever. T, IL-2, T-cell growth. Bone for IL-3, which stimulates the growth of bone marrow cells. And then steak will be written with the E and the A capitalized because E corresponds to IL-4, which promotes class switching to IgE, and actually IgG as well. And then the A will also be capitalized in steak because that corresponds to interleukin-5, which promotes class switching to IgA. So that's an easy way to remember the first 5 interleukins. Hot T-bone steak. And interleukin-1 especially, like I mentioned, you really want to know for septic shock alongside TNF-alpha. And interleukin-1 is also an osteoclastic factor. So sometimes they'll show you a picture of, say, osteoporosis or something like that, and the only answer choice that would make sense out of the ones they give to you will be IL-1. There's some other interleukins you can afford knowing, but honestly, I don't recommend you just sitting down and actually memorizing them one by one in order like that. It's better that you do questions, in my opinion, and just get used to seeing them in certain contexts and have that work aside whatever mnemonics that you have for the interleukins. Moving on, choice D, interferon beta. This is an antiviral and immunomodulatory, which is produced by fibroblasts. It can be used to prevent viral replication, but on step exam, I think the most relevant thing you want to know for interferon beta is actually the fact that it's used in the treatment of multiple sclerosis, mainly to prevent further flares. Acutely, you want to treat multiple sclerosis with IV methylprednisolone, but for long-term treatment where you want to prevent flares, you give interferon beta. Choice C, interferon gamma. This plays a role in immunity, activates JAK-STAT, enhances a number of things in the immune system, including antigen presentation. It activates macrophages, which is actually very relevant, especially in granuloma formation. So you want to know that interferon gamma can be produced by T helper cells, and then they bind onto macrophages to produce IL-12, which in turn actually goes back to naive T cells to turn them into Th1 cells to produce even more interferon gamma. So it's kind of like this self-perpetuating system between IL-12 and interferon gamma. They might ask you about this in the context of where you need granulomas to form, right? So for example, a TB infection. Interferon gamma can also be used in chronic granulomatous disease, but unintuitively in CGD, it actually modulates the immune system to be better at fighting off infection. So it's not like it encourages more granuloma formation or anything like that. That's probably a lower yield point. Mainly, like I said, you want to know interferon gamma and IL-12. You want to relate that to macrophage activation and granuloma formation. So bring it back. Look, like I said, this immunology stuff, it's hard for anybody to be able to sum up to you in brief about which interleukins you want to know and which ones you don't. But I just ran through some of the higher yield ones you might run into here. And this particular question really wasn't that hard, right? Because it's really about vasodilation. And if you don't know nitric oxide has to do with vasodilation, you might be in a bit of trouble, right? But I just took the opportunity to tell you a little bit more about some other immunology stuff that you might run into on the exam. I hope you found this video helpful. I'll see you in the next one.